How do you diagnose gluteal tendon tears, so gluteus minimus or gluteus medius, on CT? Well, it's actually quite difficult on CT because we don't see the tendon very well. But one of the things that you can do on CT is to look for evidence of atrophy or fat infiltration. And that is an indication of a severe tear or rupture of the gluteus minimus or medius tendon. The normal gluteus minimus muscle fills the space next to the eyelid. So this should all be the signal of muscles. We have normal muscle here. What we have here is that we've got small portions of muscle fibers, but most of it is actually fat. So we've got atrophy and fatty infiltration. Here's the gluteus minimus tendon, and then next to it lies gluteus medius. Gluteus medius is a fairly large muscle, so what we're seeing here is predominantly the anterior most fibers of gluteus medius. Here's the gluteus medius tendon, the anterior and lateral insertion. This should be full of muscle fibers. So you can see here that we've got muscle along here, but more distally, we've got a gap where it's filled with fat. So we've got atrophy of muscle fibers and fat infiltration. And this should be symmetric. So really, we should be having muscle fibers all the way down to here. When you look at a CT, look at the muscles as well and look for evidence of atrophy or fatty infiltration. These then give you an indication of what's actually happening to the tendon, because the tendon itself, we need the MRI to adequately assess for tendinosis or tears of the gluteal tendons. But you can use the CT to actually give you an indication of how severe the changes must be of the tendons